I think the thing that's on every man's mind and his partner as well is, when will the erections come back? And it's so important to understand that everybody's journey is different this way. And that's something that I didn't fully appreciate until I began the journey. It's still, even now, almost a year later, when you feel the stirrings, the urges, which you feel exactly the same after a prostatectomy as beforehand. No desire diminishes. You take a peek under the sheets thinking, gee, something must be happening, and in my case, nothing at all. And it's been hard to accommodate as a male, understanding how you can still feel masculine when everything since you're a young teenager is based on having an erection.
For anybody going on this journey, it's confronting, there's no doubt about it. When it just still got the desire and the want, but it doesn't work, that's very, very confronting. So you can either, as I've seen on some of the forums, lie in bed and not communicate with each other and just let that part of your life wither away, or you can do something about it. Now, I was very keen for this, Martin not so, but I said to him, well, if we're going to do this, we have to do it as a team, we have to do it together, we both have to be on board, and we both have to be positive about this and not, oh no, I'm never going to do that, or I'm not going to try this or try that.
I just went through the roof. Not this black duck, no way. I had the worst possible visions about how that professional might be helping. Does he or she sit on a stool in the bedroom? How on earth would that work? Having had her guidance in simple things that a middle-aged couple, or any couple, might not know, like the particular penile rehabilitation pump that you can use to help restore blood flow, which is a medical procedure. It's not a dirty little in the back of the room sort of procedure. It's something you need early on, or when your doctor tells you you should be doing it. How do you get one? Off the internet? You Google penis pump and you get some wild stuff jumping out over the internet at you. After the first time, it was handled so well by the consultant that we were very comfortable to ask questions, and then I think we had another 2 appointments as well. And at that stage, we're off on exploring this new phase of our lives.
Within 48 hours, Martin was able to have an orgasm, which was a very pleasant surprise, and continues to. And obviously, there's a plethora of gadgets and toys and things out there that you couldn't possibly wade through by yourself. So by getting that expertise and support and being pointed in the right direction enabled us to select some things that were easy for us to use, that we felt comfortable with.
Treat it as your physio, as your surgeon, as a visit to them might be. It is a clinical session that helps you in a physical manner. The intimacy consultant is someone that will give you some clues and some ideas about things that, if you're like me, had no idea about before, and they're not scary and it's not at all invasive whatsoever. So don't be scared, just do it.